Okay, today we're going to talk about something incredibly important, the rise of colorectal cancer in Ethiopia. We're going to look at the challenges people are facing on the ground, but also, and this is key, the advanced treatments out there that can really change everything. So let's dive right in.
I want to start with just one number, 54,698. Now, what is that? Well, according to data from 2022, that's how many people in Ethiopia die from cancer every single year. It's a huge, sobering number, and it really sets the stage for why this conversation is so urgent.
And when you dig into that massive statistic, you find that one of the biggest drivers, particularly for men, is colorectal cancer. And that's exactly what we're going to focus on and unpack today.
All right, so for our first section, let's get to the why. Why is this specific type of cancer suddenly becoming such a major public health issue across the country?
You know, on a global scale, colorectal cancer is the third most common. But here's the twist. In many high-income countries, the numbers are actually going down. The worrying trend is that it's on the rise in places like Ethiopia, where for a long time, it was considered pretty rare. That's changing, and it's changing fast.
And this chart, wow, this really brings it home. For men in Ethiopia, we're not talking about some distant threat. Colorectal cancer is already one of the top 3 deadliest cancers. This isn't a problem for the future, it is a major health threat right here, right now. So you have to ask, why the increase? Well, it's not happening in a vacuum. Research points directly to major shifts in lifestyle that are becoming more and more common. Things like different diets, less active lives, and of course, a population that is, on average, getting older. All of these are big contributing factors.
But the problem gets even more complicated. It's not just that more people are at risk. There's another massive hurdle, and that's the danger of waiting too long to get a diagnosis. Let's dig into that. So just think about that for a second. What really happens when a patient has to wait? When the healthcare system itself causes delays? Well, as you can imagine, the consequences are incredibly serious. And this quote just hits the nail on the head. It's a systemic issue, you see. You've got limited diagnostic centers, not enough public awareness about the symptoms, and an infrastructure that's stretched thin. It all adds up to one thing: people are often diagnosed only when the cancer is already in an advanced stage. And here's the heartbreaking part. Even for those who do get diagnosed, getting the standard treatment that's supposed to happen before surgery, that's things like chemoradiotherapy, well, getting it on time is often just not possible. The waiting lists are too long and the resources just aren't there. Okay, so this all leads us to the healthcare system itself. Let's look at the actual numbers, because they paint a really clear picture of the immense pressure it's under and the gap between what people need and what's currently available. Now, first things first, it is so important to acknowledge the incredible progress that's being made. The country has been actively expanding its network of cancer centers, and that is a huge step forward in providing care to more people. But, and it's a big but, when you put that progress up against the sheer scale of the challenge, the picture changes. You're talking about a population of over 120 million people being served by just 4 centers that have radiotherapy. It shows you just how massive the capacity gap really is. So, we've laid out some pretty big challenges, but what if there was another way forward? Let's totally switch gears now and explore what's possible with advanced treatment options that are available in the world today. Let's talk about one of the biggest game changers, robotic surgery. And this isn't science fiction. This is real cutting-edge medicine. It's a minimally invasive technique where doctors use an incredibly advanced robotic system to perform surgery with a level of vision, precision, and control that was just impossible before. So what does that actually mean for you, the patient? Well, it changes everything. Compared to old-school open surgery, we're talking about tiny incisions, way less pain, and a much, much faster recovery. It means getting back to your life, to your family, so much sooner. You know, this statement just captures the whole point perfectly. Getting a cancer diagnosis feels like your world has been turned upside down, but having access to the right kind of care, this precise, patient-focused care, it offers a real path to turning things back around. Okay, we've covered a lot. The challenges, the potential solutions. So what now? What can you actually do with this information? This last part is all about empowering you to take control of your own health journey. It really comes down to 3 crucial steps. Number 1, know the symptoms. Learn the early warning signs and please do not ignore them. Number 2, be your own best advocate. Don't wait, push for a prompt diagnosis. And third, and this is so important, explore all of your options. That includes looking into specialized, state-of-the-art care at world-class international hospitals in places like India, Thailand, Turkey, and the UAE, where technologies like robotic surgery are the standard of care.
Look, trying to navigate all these options alone can feel completely overwhelming. But the good news is, you don't have to. Organizations like MedTravel Ethiopia are there specifically to help connect patients with these advanced treatment centers. They provide the support and the information you need to access this kind of precision care. Remember, it's your health journey, and knowing all your options is the first and most powerful step you can take.